Hello, today is April 10th, 2018. My name is Kinsey Rule, and I will be examining my patient ADD, doing a HEENT video. I have gathered my equipment. I have provided privacy for my patient. I have previously washed my hands prior to this video. I've observed the general appearance of my patient. There's no obvious physical deformities. Her personal hygiene is adequate. Her clothing is appropriate for the season. She's clean and neat. She's not disheveled. She's not disorganized. Her skin color will be noted throughout the exam, but as you can see, she has a pale tone throughout head and all the way through her neck. Her posture and positioning, she's in a neutral position. Her posture, her back is at back. Her shoulders are up. Her affect and mood, she's generally a pleasant person, and her speech is adequate. There's no slurring of the words. She has no problem hearing. She is a mother of a toddler, so we have checked all of these. Her nutritional status is adequate for her age. There's no observation of any type of malnutrition. Now I'm going to move on to the head and face. If you observe and you look, she makes eye contact with the camera. Her level of consciousness, she's awake and she's alert to her surroundings. She's oriented to the person, place, situation, and time. Now, if you inspect her scalp or hair, she is clean, she's neat, she's been showered. She takes good care of her own personal hygiene. Her cranium is not asymmetrical. If you look at her face, it is symmetrical. Her eyes align across. Her nose is straight down the center of her face. So now if you see, you can palpate her temporal arteries on both sides. You can feel them, they're palpable. And as you can tell, there's no labored breathing or anything like that. So her frontal sinuses, everything's clear and open. She's not sick. She does not have a cold. She's not running a fever. And now moving on to the eyes, we're going to start with the confrontation test, and we're going to be checking her peripheral. So I'll ask my patient to cover her left eye, and while staring at the wall, you can tell me how many fingers I'm holding up here.
5.
Yeah, watch the wall.
Oh.
Okay. Now using your peripherals, how many fingers do I have up?
4. 3. 2. I don't know.
Now we can switch.
5. 4. 2. 1.
All right, and now we'll do the corneal light reflexes. We're going to be checking for an even gaze as she stares straight towards the wall in front of us. I'll also be checking for the red reflex in her eyes. And I'm not sure what you can see in the video, but she has an even gaze, and she has the red dots. That's the reflection from the back of the eye. So the 6 cardinal positions of gaze, we're going to be checking the cranial nerves 3, 4, and 6. That's the superior and inferior rectus, the superior and inferior oblique, and the lateral and medial rectus. So, Ashlyn, if you look over here, just follow my hand with your eyes. And now you can see that her eyes move across laterally and medially. Okay, so now I'll ask you to cover one eye with my paddle. And you can see 15 feet ahead of you, correct?
Yes.
And now if you switch, and you can see the same poster on the back of the wall, correct?
Yes.
Okay, will you please take off your glasses? Now we're going to inspect the external structures, the conjunctiva, the sclera, corneas, irises, pupil size. Try to get as close as possible. But looking on the outside, she has beautiful makeup done. So you can see that the external part of her eye, she has full eyelashes, top and bottom. And the conjunctivitis, there's no kind of discharge, yellowish discharge, anything like that. Her sclera are white, her irises, their color, her pupils are about a size 3, size 4. And then I will also be checking Perla with this. So Ashlyn, if you watch my pen and follow it back, and if you watch it again and follow it back, you can see that her eyes accommodate to the Perla method. Now I would just like to verbalize how I would test vision with a Snellen chart. My patient would stand 20 feet back from a Snellen chart and would try to read the smallest line that was legible to her. If she could not read, she would just keep going up the row and seeing which one she could see clearly. And depending on which line she could read, that gives us the results of a Snellen test. So, Emma, please go into your room.
Go.
Okay, I apologize for that interruption. Like I said, my patient is a mother to a 3-year-old, and this was the only time we could video record for this project. So we will just continue where we left off with the ears. If Ashlyn, you'll turn your head to the right, I'm going to pull back and we can inspect her left ear first. As you see, there's no drainage, there's no lesions. Skin matches the same skin tone as you go down to her neck. And if you'll turn to the left, we'll do the same with your right ear. As you see, no drainage, no lesions, and the skin tone is congruent with her neck tone. I do not have an otoscope. It did not come in the mail, and I know I posted this on Tuesday, but this was the only time that my patient was available for this video recording as well. But at this time, I would take an otoscope and I would inspect her ear canal and her tympanic membrane. I would look for the clear shininess of the tympanic membrane, make sure there's no clogs or any kind of debris in her ear canal. So next I'm going to do the voice whisper test. I'm going to ask Ashlyn to obscure her right ear so she can't hear out of it. And I'm going to whisper two syllables in her ear, and I'm going to ask her to repeat those back to me.
Emma Jane.
And we'll go on this side, and we'll switch ears of obscuring. And I will whisper 2 more syllables in her ear. If I can think of something. Jordan Marie.
Jordan Murray.
Awesome. All right, my next step is to move on to the nose. As you look at Ashlyn's face, you can inspect that her nose is symmetrical in her face. Her nares are symmetrical horizontal, and there's no lesions, there's no crusting, there's no nasal drainage or discharge of any sort. And next I'll check the patency of her nostrils. So with permission from my patient, I am going to lightly stick this Q-tip around her nostril and switch each side. So Ashlyn does have a nose piercing, so that's something that we always want to make a note about with our patients. So there's no stopping, there's no foreign object occluding my Q-tip going into her nostril. And it's the same on her right side. And I will dispose of that. And I also don't have a speculum to inspect inside of her nose, but at this point, I would check the mucosal membrane, I would check her septum, and the turbinates of her nose. Moving on, we have nose and throat. So if Ashlyn would open her mouth, I would inspect her buccal mucosa, teeth, gums, tongue, the floor of her mouth, and her palate. So as we look in here, there's no sores, there's no redness, tearing of any that I can see. And we're going to move on to her uvula. So it's actually, if you open your mouth, stick your tongue out, you can see in the back of her throat that her uvula is pink, it's moist, everything looks good, and also her tonsils are at a grade 0. That means that there's no swelling, there's no obstruction of the airway, which is fabulous. And then next, I'm going to check Ashlyn's cranial nerve 9 and 10. So Ashlyn, if you open your mouth, stick out your tongue and say ah, you can tell that her cranial nerve 9, 10, and actually her cranial nerve 12, because her tongue came out, works fine. Next, we'll move on to the neck. So I'm going to pull Ashlyn's hair back. You can inspect that her neck is symmetrical. There's no noticeable masses, no pulsations, and jugular venous distension. So I'm going to palpate her carotid on her left side. She has a good strong pulse. I'm going to come over onto the left, or on her right side, and it's good pulsation. Notice that I didn't do both the carotid arteries at the same time. This can make the patient feel lightheaded and possibly get dizzy, cut off circulation to her brain. Alright, so picking back up where we left off with the neck, I just palpated Ashlyn's carotid pulses on both sides. You can tell that her trachea is set midline, it's in a neutral position, there's no deviation to the left or the right, and you can tell that her thyroid, there's no abnormal masses, there's nothing to actually palpate with the thyroid, so I would not check for a Bruits at this time. Next, I'm going to palpate Ashlyn's lymph nodes of her neck and her head. So I'm going to start on site 1 of the preocular, which is, if you turn your head to the right, please, just up here. And then you would move down back posterior ocular. And then if you look forward for me, please, we are going to move down to the submental. And as I'm doing this, I'm checking to see if there's any free, like, we're looking for lymph nodes to be free moving, non-tender, soft. If you come across some firm, kind of like a mass, that's when you would be concerned about your findings. So after 3, I would check the submandibular down here on both sides, and in a real exam, I would be doing this simultaneously to make sure that each position feels correct on the left and the right side at the same time. So then we're going to go to 6. Feel under here at the, pardon my pronunciation of this, and I'm going to butcher it really bad, with the jugulogastro lymph nodes, and move down to the superficial cervical, and once you get towards down here, the deep cervical and the posterior cervical, and then the supraclavicular would be right above your